Hello? Hello? Testing? Testing? Can you hear me? Is everybody here? This is a podcast made by people with disabilities for people with disabilities. I'm your host, Angie Keegan. Each episode, we are going to be bringing you content that matters to us, the disability community of Caboolture and the surrounding areas. We'll be talking to guests here and getting out into the community where we want you to tell us about what you want to hear about. Subscribe, like, and follow us on all the social media platforms and tell your mates. Welcome. We acknowledge the traditional owners of the Gubbi Gubbi lands on which this podcast is recorded. We pay our respects to the elders past and present and acknowledge the important role Aboriginal and Torres Strait Islander people continue to play within the community. So, welcome to the show, everybody. This is today we have got the lovely Wendy McCracken.
Glasses.
Yeah, welcome, Wendy.
Thank you, Ange.
Everyone, Wendy is definitely one of our pillars of our community in the disability field in Caboolture. I'm sure a lot of people will already know who you are. But should we start with some descriptions of ourselves? Yeah? Mm-hmm. Would you like to begin, or do you want me to?
You start.
Oh, all right. Okay. I am a 48-year-old pale beige person with dark brown hair, short hair. I'm wearing jeans and I'm wearing a denim jacket with lots of badges on it. And I'm wearing excessive amounts of jewelry, as usual. Yes. Wendy?
Okay. I'm 66 now, sorry.
Oh.
Yeah. Old lady with brown hair. I've got my glasses on at the moment. I've got a brown and tan and black dress on with a goldy watch. And I think that's about it.
Yep. And we hear from your accent that you are from New Zealand.
A Kiwi.
Yes.
Originally.
Yes. Lovely. Well, thank you so much for coming on the show today, Wendy. And I'm incredibly impressed because you've just come from a night shift. Yes.
I have.
Yes.
Yeah.
And Wendy is a nurse, for those that may not know. And Wendy has come today to talk to us about some pretty essential things that we need to know about when we go to hospital and we have to stay in as an inpatient. So I'm really, really happy to talk to Wendy. And should we tell them, like, your connection to the podcast, or leave that till later?
Oh, whenever you want to.
Okay. So the lovely Wendy is instrumental in us having this podcast at all. So Wendy was the person who was kind enough to put up much of the money for the bursary that went to QDN, and that was the Matt McCracken bursary. And Matt McCracken is, of course,
my husband.
Yeah. And so it's because of Wendy that the bursary came into being, and that is, of course, how this podcast exists.
This is great.
Yes. And the name Is Everybody Here is also really important. And I asked Wendy for her permission to use the name, and she graciously did, of course. That's how we got it. But would you like to give some background to the name?
Is Everybody Here Day? Matt used to run it every year up at the Centenary Lakes for people with disabilities, so people could go and visit. I hate these. At which we got good crowds and everything like that.
Mm-hmm.
So it was amazing, and he did a really thorough job of everything. It was a lot of planning, a lot of hard work.
Yeah.
But it went off extremely well, and he was always very happy with everything.
Oh, awesome. And so when did that actually start, Wendy?
It was way back, I think, in about 2000 and I think it was about 5, I think.
Oh,
Or
wow.
9 or something.
Okay.
It was quite early.
Yeah, okay.
Yeah.
Excellent. So, yeah, a long-standing thing. Yeah, for sure. And that was also one of Matt's key sort of questions to ask.
Oh, yeah. He was really.
Yeah.
That was one of his, everything he did every year, you know, like he loved doing it.
Mm-hmm. Absolutely.
Being involved.
Yeah, but Matt very much thought the question itself, is everybody here?
Yeah.
Was the fundamental question.
Yes.
And it is, isn't it?
It was really good.
Yeah, for sure. Well,
great name.
Absolutely, for sure. And thank you so much for everything. Because honestly, without you, we wouldn't be here. So thank you. Super impressed that you're here, and yeah, it's a great honour. Thank you.
That's right. Thank you.
Okay, so I guess we should get on with it and talk about what we're here to talk about.
Well, you ask the question.
Yes, okay. So, sorry. Wendy's a bit nervous, and I am, of course, new to podcasting, so it's a good combination. Okay, so Wendy is a nurse in our local community, and she was talking to me about what she'd like to talk about on the podcast, and she came up with, hey, I'd love to talk to people about what they can expect and what they need to do, and all the information around things like having your supports in hospital with you when you've got to stay in as a person with disabilities. And we got to talking about support workers, and assistive animals. So, Wendy, can you tell us a little bit about assistive animals? So, if we have an assistive animal, can we take them into hospital first of all?
It depends what you can take in. Sometimes you can take them in.
Yeah.
And there is a procedure that you've got to go through. They've got to go apply for it, all that sort of thing.
Okay. And is that a form?
There is a form. I haven't actually looked at it.
No, that's okay.
It's just really a risk. There's a lot of risk assessments and everything they need to be done, and what sort of thing with things.
So it's not just any animal. You can't just go, hey, look, I've got a pet and I want to take them into hospital with me.
They say guide dogs, hearing and assistant dogs, and pet therapy dogs.
Okay, so they've got to be registered as assistive dogs.
Yes.
Yeah.
And they've got to wear the right coats that they have, to state what they're doing.
Excellent. Yeah, that they're at work. Yeah.
Yeah, to let them know.
Yeah.
If they're their own pets, they can go down outside and have them down there, but they can't bring them up into the hospital setting.
Oh, okay. So if they're their own
pets,
right.
They're allowed to go down, but they can't bring them up to the ward. They have been snuck up.
Okay, but we're not encouraging them.
No,
no.
No, they can get a lot of trouble for that.
Yeah, absolutely. Yeah. Okay, so you could get like a family member or your support worker or something to actually bring them to the grounds.
Yes.
And then you can go down and visit your pet. But if they're actually your assistive animal,
and I think, they're allowed up. But as I said, it's got to wear a guide dog vest or a supportive therapy dog, all that sort of thing. So.
Okay, is that something that happens very often?
You do get it because people will ask if they can bring them in.
Sure.
And a lot of people in the community have dogs that they can have, like the Labradoodles and Labradors, everything, and they need them there too.
Yeah.
And I think otherwise they miss contact with them, and I think it's good that they can keep contact with them.
Oh, for sure. Absolutely.
Yeah.
Especially if they're a dog that, say, is trained to know when they're about to have a seizure or something.
And in their life and all that sort of thing.
For sure. Absolutely. And are there special things that you need to do before you bring your assistive animal?
Oh, make sure they go to the toilet.
Okay. That seems like a good idea.
You've just got to get the from the hierarchy at the hospitals. They have to be able to give the okay that you can bring them in.
Okay, so you've got to give them notice. You can't just go, no,
you can't just bring them in.
Yeah, okay. Yeah. Righto. And I guess that comes back to the form and
procedures and everything. They've got to fill the form out.
Sure.
Say who's going to bring it in and all that sort of thing.
Okay. Yeah. And I guess in that would also be like how long you intend to have the dog there, because they couldn't stay 24 hours a day.
Yes. They can't say 24 hours.
Yeah.
I think they can have them for a certain time. They can't live at the hospital or anything like that.
Oh, okay.
Just bring them in, like, visitations and all that sort of thing. So.
Okay. So someone's going to need to bring them in and out, which I guess brings me to the other question. And I know that these rules and regulations are kind of shifting and changing a little bit. So obviously everyone always check before you do any of this stuff. But at the moment, as it stands, support workers in hospitals, I know that there's some mixed feelings in the health system about that.
Yes.
Yes. And can you talk a little bit from your perspective?
From my perspective, I think they should be allowed to.
Yeah. Mm-hmm.
Anyone who has NDIS support workers should be allowed to stay there. The patients themselves rely on them at home.
Yep.
And they're the ones that know more about what's going on with them than even the nurses. You know, the nurses don't know what to do sometimes, and it just helps out with the support workers being there and everything. But sometimes the hospital setting, they say, no, they're not supposed to be there. But other places will say yes. So.
Okay. So is that something, do you think that if you have a support worker and you want them there, is that something that you would do, that you would check with maybe the nurse in charge or with the hospital before?
It's got to go through the hospital coordinator and the hierarchy as well, the director of nursing, I think, as well. So
okay, so if you get it sort of ticked off there, then if someone's maybe on a shift and they go, hey, what are they doing there? You can say, oh, actually,
especially if they're 24-hour care, they need to be. I think it just helps out a lot.
Oh, yeah.
It helps the patient settle in themselves as well.
Mm-hmm, yeah.
And I think they feel more comfortable having their support worker there.
Yeah, absolutely.
I used to do it for Matt.
Yeah, of course.
And Matt had his support workers there too, so come in, it just saves the nursing staff doing it as well, because we know what we're doing.
Yeah.
Whereas the nursing staff don't always know.
No, and they're in a rush.
Yeah.
They've got other things
to do. They're always in a rush. They think they are.
Absolutely. Yeah, whereas the support worker would be there just for
to care for the person that they look after, the NDIS.
Absolutely. And I think, as we know, with particular disabilities and particular needs, sometimes, you know, not intentionally, but you might be injured because somebody doesn't know how you need to be handled or, you know, what your particular care needs are. So it kind of would avoid all of that as well if you had your trained support workers there as well. So it's got to be better for the nurses.
Oh, yeah, family even as well, sometimes as well. So
yeah, for sure. Okay, is there something that people should know that they shouldn't do with either support animals or having support workers?
So what was that?
Is there something that you think is a big no-no? Like, do not do this. If you're thinking, oh, I want my support worker here, what would you...
if it was me, I'd say yes, they can have them there.
Yeah, absolutely.
but I don't know why they don't sometimes.
Yeah.
I honestly don't. Mm-hmm. It makes me a bit angry to think that, considering...
Yeah.
You know, they're the ones who've been like that for years and they need them there, so... Yeah,
absolutely. Okay, cool. So as long as there's open communication, you're checking with the... what was the role of the person again, or the department to check with?
You have to go through the director of nursing to start with, as well as the NUM and hospital coordinators.
Okay.
There's just a few people.
Yeah, okay, awesome. And I've seen, like, when I've been in hospital myself, you know, hanging out in ED, in the emergency department, I'll see there'll be people coming in, like support workers coming in, ready to be there for the participant, like the person with disabilities, and they'll be waiting because the person's coming in an ambulance or whatnot. So, yeah, in that situation, that's kind of a duty of care thing, isn't it?
It is duty of care.
Yeah.
It is. It really is, so.
Yeah. Mm-hmm.
And also that, like, even when Matt was in hospital and they weren't going to let me in, and I said, Matt he couldn't do anything.
Yeah.
He needed me in there.
Yeah.
And to get in, I have to go and get something to say, oh, he needs me in there, let me in. Because they didn't have any idea.
And is this like on the ward or in the emergency?
That was an emergency.
Yeah.
But it depends who I guess you see at the triage desk too.
Yeah, well, that's right, yeah. 100%.
Whether they know or not. So quite often you can see support workers going in, but they get told, oh, you can't stay overnight. You have to go home. But sometimes it's the best time for them to stay as well when they do their cares at home overnight.
Yeah, absolutely. Okay, would it be a useful thing then for people with disabilities to maybe write up some instructions?
I think we should all be kicking up the storm.
Yeah, okay.
And saying we need them in hospitals,
Yeah.
So.
Absolutely. So
there should be something with NDIS. They should be able to.
Yeah.
Oh, I think it's to do with the funding or something like that sometimes as well, that they can't have them in there.
Yeah. Yeah. Yeah.
But and then the hospital say no, they can't stay.
Yeah. Yeah. Mm-hmm.
And then it does annoy me. I get angry. I get off my high horse.
I don't think that's being on your high horse at all. I think that's it's logical though, right?
Yeah,
but I also hear arguments at the moment because NDIS doesn't want to fund something that the health department funds.
Yeah,
and the health department doesn't want to fund anything that the NDIS could fund. So you have this kind of tension between the two. But of course, there's a person.
I think that's where the fallout is.
Yeah, exactly. And then there's the person with disability in the middle, just needing support. And does it matter really who does it, as long as it gets done? So
definitely, yeah.
Yeah. So there's either like a double up or there's nothing.
Yeah.
And
yes.
Yeah. Yeah. So I guess in that case, if you require more care than, say, a regular person in hospital would need, obviously you're sick because you're in hospital, then and that sort of shortfall is going to be made up by having a support worker there and lighten the load for the health, for the nurses and doctors and whoever.
Yeah.
Then it would be to everyone's benefit.
Yeah.
Yeah.
I think so, yeah.
Yeah, absolutely. So maybe something we could do is actually write down in the case of I have to be hospitalised for whatever reason, these are my particular needs that I have, and I need my support worker with me because of these reasons. So
if they need them.
Yeah, so before you're in a crisis situation, you've actually thought about the reasons, and then maybe that's something you grab with your go bag.
Yeah.
Yeah. Okay. And then that can go to the hospital administration.
Yeah, to say why they need them.
Yeah, yeah. Because it sounds to me like I think ultimately everybody wants the best thing for the people, right?
Yeah.
Yeah. But everybody also wants to cover their own backsides.
Oh, yes, definitely. They do, don't they?
Yes, they do. But also just to make sure that all of the right things are ticked. The boxes are done and the forms are filled out. Yeah.
All the correct boxes, definitely.
Yes, absolutely. We're dealing with government departments after all, right?
Oh, I know. It's a pain.
Absolutely. So do you have any particular advice or wisdom or anything?
Any advice?
Advice or wisdoms to share from your perspective as being a nurse, but also being a family member of a person with significant disability?
I get on well with people when they come in, I think, and
yeah.
I think I understand a lot more than what other nurses probably do because they've not had anything to do with disability.
Yeah, true.
Whereas I have, but I'm not there all the time either. So.
No. Yeah. So,
and it's good to go and see somebody who you know.
Absolutely, yeah.
That's in there. No, I think they should be allowed in. I think they should all.
Absolutely. So it's about us using our voices.
Yeah, I think that's what a lot of it is going to be.
Yeah. Okay, good. Well, I think that's something we should be communicating maybe to our ministers. And we've got an election.
Yeah.
It's always a good time to get the voice out there. Yeah. But even without an election, I think making the people in power aware of how they serve us.
Disability, it should come at the top, just about disability should, because there's a lot of people around.
For sure.
Yeah.
Absolutely. thank you so very, very much, Wendy.
That's all right.
Yeah. Okay. And I've got one more question for you. If you could change anything right now in the Caboolture and Moreton Bay area that would make the place or make the Caboolture Moreton Bay area more accessible, what would it be?
Well, I think they need to do that. They need to make it more. I think the government should be more aware of people with disabilities too. Mm-hmm. Not all of them are.
No. Yep. And so, and awareness.
With disabilities, they should have the right kind of things around, like roads, footpaths.
Yes, infrastructure, yeah.
Yeah, everything like that. Housing. I think they need more housing in places for people with disabilities. Not on second floors, first floors or whatever.
Yeah.
They need to be on ground floors, a lot of them too.
Absolutely.
Not in where places they need lifts to get up there because they break down.
Exactly.
How are they going to get down?
Yeah, and wouldn't it be cheaper just to, like, have housing on the ground floor?
Yes, it would be.
Than to provide a lift.
Well, you could put some that, but not people in wheelchairs up on the second floor. People that needed to be, like walk with walkers and like the likes of you as well. You know, you can't be up there walking up and down stairs.
No, that's right.
Or going to lifts when they're out.
Absolutely, but I was just thinking, because I said, wouldn't it be cheaper just to have it on the ground floor? But at the same time, people with disabilities want to go visit their mates that are on the second floor.
Exactly, they do too.
And as we should be able to, like anybody else.
Like anybody, yeah.
Absolutely.
I think that's correct.
Okay, awesome. Well, thank you again, Wendy. I have really enjoyed our chat. And
is it over already?
See, I told you it wouldn't be that bad.
Okay.
Can we get you on again one day?
Yeah, I'll try something else. I'm trying to think about something else now. I'll have to.
Okay, well, I think you're just such an important part of our community, and it would be great to keep in contact.
Thank you, Angie.
Okay, thank you, Wendy.
Thank you for that.
Okay,
great.
Take care.
Can I take this off?
Bye.
Whoa, it sounded really weird.